Okay, let's go ahead and get started. Or you can go to the next slide. Thank you all so much for being here for our second technical expert panel meeting for the CMMP. We're just going to do some quick introductions and then some reorienting to the CMMP. We have some new members, and so we thought it would be important to take some time to introduce ourselves and let each other know where we're from and what expertise you have for the CMMP, and then kind of reorient what our roles are for the TEP, what the responsibilities are for the TEP. And then I'll turn things over to Helen to talk a little bit more in detail about the CMMP TA plan that you all received ahead of time, along with our resource repository. Talk a little bit about that. We'll then do some questions and polls for you all towards the end of the meeting, and get your feedback on some things, and then we'll close out. So shouldn't take too long, and we'll get you on your way with the rest of your afternoon. Next slide, Laura, please. So if you wouldn't mind putting in the chat your name, your organization, affiliation, your area of expertise, and where you're joining from today, that would be wonderful. But we also want to give each of you an opportunity to introduce yourselves and let the rest of the group know who you are, where you're from, and your area of expertise. And so I'm just going to go down the screen that I have and start with Jamie, if you would mind kicking us off and letting us know who you are and your area of expertise.
Sure. Jamie Snyder, former Medicaid director in Texas and Arizona. Now have my own independent consulting practice, but I also serve on the Medicaid and CHIP Payment and Access Commission. And I'm joining today from Santa Fe, New Mexico.
Thanks so much, Jamie. Great to have you here. Jeff Schiff, how about you?
Hi, everybody. I'm Jeff Schiff. I'm a senior scholar at Academy Health. I'm a past Medicaid medical director, pediatrician, and I am coming from Park City, Utah.
Thanks so much, Jeff. Let's go, Heather Smith.
Hi, everyone. Heather Smith. I am a director on the Child and Family Health team at NASHP, the National Academy for State Health Policy. And my role here is to provide support to states as they think about all the different ways they can innovate to improve access to care for children and families through state health policies. Prior to being at NASHP, I was a Title V director in the state of Kansas for quite a few years. So I have some quite a bit of Title V background and experience as well. So happy to be here. And I am coming from Kansas City, Kansas.
Thanks so much, Heather. Great to have you. Deborah Waldron.
Good afternoon, Deborah Waldron, coming from the American Academy of Pediatrics, one of the senior vice presidents there. It's good to see so many familiar faces. And I'm joining today from Maryland, and my area of expertise is children and youth with special healthcare needs, having been the former Iowa Title V SHIN director, as well as the former director of the Division of Children with Special Healthcare Needs at the Maternal and Child Health Bureau.
Wonderful. Thanks, Deborah. Great to have you. Christina Boothby.
Hey, everyone. I'm Christina Boothby from the American Academy of Pediatrics, and I oversee all our children and youth with special healthcare needs initiatives at the AAP, including our National Center for a System of Services for SHIN that works very closely with state Title V programs. And I'm joining from Illinois, just outside the Chicago area.
Thanks, Christina. Kevin Koenig.
Hi, everyone. Kevin Koenig. I'm in CMMI within CMS, working on the Transforming Maternal Health, or TEMA, care delivery and payment model. I'm the payment lead for the model. Has some, I don't know, I'm an expert on anything, but expertise in maternal health, value-based payment. Did that for a long time before coming to CMMI. And I'm based in St. Louis, Missouri. I'm really glad to be here.
Thanks, Kevin. Great to have you. Michelle Proser.
Hi, everyone. I'm Michelle Pritter. I'm with Medicaid Health Plans of America and leading our research strategy and our research work. Prior to that, I was actually at the National Association of Community Health Centers. I have many, many years experience working in the safety net, now from the payer side, but also the provider side. And I've also done some work on the work to build sectors to address health-related social needs as well, everywhere from screening to actually program development and partnership development.
Thank you so much. Great to have you. Brina Holmes.
Hi, everyone. I'm Brina Holmes. I am, multiple hats overlapping with a lot of you. So a general pediatrician. I was the Title V maternal and child health director in Vermont for 12 years. I am now at the Vermont Child Health Improvement Program, and I'm the AAP chapter president for Vermont, which I think might be an important perspective. We have some national AAP folks, but I'm a chapter leader. And I think my primary expertise that spans all that is the integration of public health into clinical care and the partnerships therein. Nice to see everyone.
Thank you so much. Great to have you. Enrique.
Hello, everyone. I'm Enrique Martinez Vidal. I'm Vice President for Quality and Operations at the Association for Community Affiliated Plans. We're a national trade association of nonprofit safety net health plans, 84 of them with 30 million covered lives, all of them with a Medicaid contract. I work with our plans on quality improvement, operational strategies. That includes health equity, SDOH, and obviously all the maternal and infant care issues that they're concerned with. Have been there for 6 years, was 13 years at Academy Health, worked with Kevin and Jeff there, and prior to that worked in the state of Maryland. ACAP is in DC, but I am currently in Portland, Oregon for about half the year, and the other half I live in Santa Fe, New Mexico. So Jamie, we'll have to go get a drink at the Dragon Room sometime.
Absolutely.
Good to be here.
Thank you. Thank you so much. Kimberly.
Hi, everybody. I am Kimberly Ruby. This is my first meeting today. I am at the North Dakota Department of Health and Human Services. I was previously the Children and Youth with Special Healthcare Needs Director for Title V, and now I am the Title V Director overseeing all maternal and child health, and I am joining you from Wilton, North Dakota.
Thanks, Kimberly. Lindsay.
Hey, everybody. Lindsay Browning with the National Association of Medicaid Directors. I lead NAMD's programming to support peer-to-peer learning among Medicaid directors and their teams. I'm joining from DC, and fun fact, actually had my roots, professional roots are in children's health. I got my start working for the Children's Hospital Association. So really glad to be here with you all.
Thanks, Lindsay. Shonda.
Up there. Hi, I'm Shonda Hicks. I'm coming from Washington State. I'm a parent of 3 children who have medical complexity, IDDD. My middle son has Down syndrome. I'm also the Assistant Director to Family Health Information Center here in Washington State, as well as faculty at the University of Washington for the LEND program and support the IHDD. Also the family co-lead for the Trishkin Blueprint for Change here in Washington State. And my area of expertise is probably lived experience. We've done it all. So happy to share and happy to be here. It's my first meeting as well. Thank you.
Thanks, Shonda. Naomi.
Hi, everyone. I am Naomi Williams. I'm joining you from what was formerly Muskogee land, Augusta, Georgia. I am the founder of Exceptional Living 101. I'm a health educator by training, but my expertise comes from lived experience. My son and I are living out the consequences of not being listened to during my pregnancy. He is a child with complex medical needs. I think that covers me.
Thanks for being here, Naomi. And Katie.
Hi. I'm usually not ever the only Katie on a meeting, so you're talking about me, right?
Yeah, yeah.
Sorry to be late. My name is Katie Barrett. I work on the AHEAD model at CMMI, but previously did a lot of advocacy work in maternal health. I ran an organization called March for Moms. I personally have lived experience with a postpartum hemorrhage, and I guess my areas of expertise are Medicaid financing specifically, and really passionate about the topic of bringing together Title V financing and Medicaid 1115 and payment reform. So I'm excited to be here and be in such incredible company. I live outside Boston. Thanks.
Thanks, Katie. So I think that's it. We have a couple of members that weren't able to join us today, but we heard from the first meeting that you all had wanted to know a little bit more about each other and what your backgrounds were and what your areas of expertise were. And so thanks so much for kind of indulging us in this round robin of who we all are. I think it's important though. Go ahead, Laura, with the next slide, please. So a little bit of reorienting to the CMMP. Want to just kind of level set us. As you heard, some of us are new to the TEP, and so that's our first meeting, but just kind of wanted to go through these things for all of us. Next slide, Laura. Thank you. So the CMMP really has 4 major goals over the next 5 years that we want to accomplish. Increasing the development and expansion, implementation, and monitoring of MCH policies and practices, formalizing policies and accountability mechanisms that guide and sustain coordination between key programs, supporting the uptake of innovative payment models for MCH populations, and maximizing resources to scale and sustain changes. When we look at those goals, we're really guided by 4 major principles on everything that we're doing in this space. We want to build on existing efforts, including the available research, programmatic evidence, and field expertise that we have. We want to engage community members and people with lived experience to inform the strategies and innovations. We want to apply a collective impact lens to promote partnership and a common agenda and share our understandings across all of our activities. And then we want to approach all of our activities with a sustainability as a core requirement. We want to ensure that the changes and improvements that we make can be operationalized over a long term. Next slide, Laura. So as we talk through the CMMP and what our activities are and the goals that we're trying to achieve, one thing is paramount to what we're doing. We want the CMMP to be flexible and responsive to the shifting priorities and implementation of context to what's going on. Our technical assistant components are comprised of providing direct state-specific tailored support to state Title V, CHIP, and Medicaid programs to achieve innovative financing models to improve their access to quality care among the MCH population and to advance some of the strategies that they may already currently be doing. We want to be able to provide one-on-one direct support to improve interagency agreements and related processes and practices. We want to guide coordination between Title V and Medicaid programs. And finally, we want to build knowledge and shared priorities among state Medicaid, CHIP, and Title V programs, all with a focus on sustainability beyond just our funding period. Next slide, Laura. So I want to reorient us just a little bit on our expectations of you all. We're made up of, as you've heard, former and current Title V directors, former state Medicaid directors, managed care organizations, national and state MCH-focused member organizations, people with lived experiences, and other subject matter experts. We will continuously look at what it is where our members are and where our experiences and expertise are needed. And Laura, you can go to the next slide, please. And we'll identify new members and fill our gaps where needed. And again, next slide, Laura, please. So the TEP, what we want to do is make sure, actually go back one.
Yeah, I think there's a little lag, Beth. So we are
Okay.
now seeing the first slide for anticipated member roles.
Awesome, great. So what can you expect while you're here? Well, we would ask that you participate in quarterly virtual meetings. This is the second one for the year. There may be some ad hoc smaller group meetings if needed to pull in some of your expertise. We'll ask you to provide input and contribute to the review of some of our activities and our approaches, including some of the things that you see here. Today, we're going to talk about our TA approach and want your feedback on how we're thinking about approaching the technical assistance aspects of the CMMP. We would love your support and promotion and dissemination of the CMMP information and resources. And we would love to hear your feedback on your experiences with the TEP so that we can continually improve how these meetings are run, what we do in these meetings, and make the most of your time and be sure we're most effective. Next slide, please, Laura. What we will not expect you to do is spend time thinking about allocation of resources or prioritization of TA requests. We won't ask you to be part of specific TA requests. We won't ask you to be part of TA sessions unless there's a specific area of expertise that is pretty nuanced, and we know that one of you may have that level of knowledge that we might want to draw on. We may ask then, but overall, we won't tap you for those kind of day-to-day things, and we won't ask you to be part of the selection of the 7-state cohorts, reviewing all those applications and weighing in. So we just kind of wanted to level set us on what we do expect and what we would love to see from you, and then kind of set your mind at ease that this isn't going to be another quarter-time job on top of your already full-time jobs. So next slide, Laura. With that, I'm going to hand things over to Helen, who will walk us through the CMMP TA plan to get your feedback.
Thank you, Beth. Yeah, this is a prime example of one of the things we really do want to leverage you all for, getting your input, feedback and review of sort of the things that we're moving forward, the plans that we're building. And so today we wanted to try to start doing so. Ahead of this meeting, there were probably quite a few emails from me. I'm the project manager for this work, so I don't think that'll change. I'll probably stay in your inbox somewhat regularly. But one of the things that we sent around was a draft of the TA plan for the learning community cohort. This is the cohort of up to 7 states per year that we will be working with across an entire learning community timeline on their specific goals, but also on that peer-to-peer learning and sharing and working towards some shared goals as well. So we sent that around. We are currently working on the exact application for that cohort, working very closely with our partners at HRSA, and are hoping to have it, ironed out and a timeline, an updated timeline ready soon. We'll eventually, when that is moving forward, we will be, working with you all to see if there's or to ask for opportunities for you to help us promote that work to share with your audiences. It would, be in the form of approved dissemination language that can go into emails or newsletters or social media to make it, very easy for you to share, but a way for us to spread the word and gain interest and gather just awareness across the states that this is an opportunity for them. But as we prepare for that, we have taken the time to map out what the participating states in that cohort would receive in terms of TA. And so we've developed an overview of the full 12 months that we want to talk through today, really focused on getting your feedback, getting input, hearing where you would like to, provide information, provide resources, serve as an expert for something, present to the group, share something that your organization is doing. And then really getting, the high level, does this plan make sense? So if we go on to the next slide, we can kind of, I'm going to run through stuff, and I apologize for a little bit of the boring didactic before we get to the feedback. But as it's stated in the document, and how I've said a couple times before, or how it's been said a couple times before today, up to 7 state Title V, Medicaid, and CHIP agencies working together will be selected to participate in the CMMP Learning Community Cohort, which you might see in places identified as LCC or CMMP LCC. It will last 12 months, and during this time, all of the state teams will receive focused TA from the full CMMP TA team, which includes you all. In the December meeting, we gave an overview of us and our partners, and so we have the Altarum team, we have the Center for Healthcare Strategies, Association for Maternal and Child Health Programs, and Family Voices, all working in partnership to make sure we provide, rounded and comprehensive TA, and then also leaning on the expertise that you all bring to the table as well. As participating states in the LCC, they will all complete a family engagement and systems assessment tool called the FESAT. It is something that Family Voices has developed and leveraged with a lot of agencies and has a lot of success in working with that for states to understand their family engagement and person with lived experience engagement current state and sort of ways to improve that engagement piece. They will all establish a CMMP state work group and develop their unique CMMP action plan with the goals for their state. Then they'll receive TA related to our key focal areas. So what was mentioned before, sort of the financing and funding, interagency agreements, collaboration and partnerships with families with persons with lived experience. And then that TA will be provided to all states together in multiple events, and then also more geared toward their exact action plan in their one-on-one sessions with their TA team. They'll also be participating in the CMMP portal discussion board and work closely with their TA team and peers during those sessions, as I mentioned. They're going to have a lot of opportunities for those individual times with TA, but also with each other. There's going to be, there's currently a total plan of 12 meetings, approximately 1 per month, that will include full cohort meetings, office hours, and TA check-ins that would be state specific. Office hours will be optional, but we are requiring in the application that they agree to attend those other sessions, the peer sessions, those full group sessions, and the 5 monthly sessions with their TA team. The topics of these sessions will evolve. It will, begin with a focus on that FESAT, and then establishing their work groups and CMMP action plans, determining their vision and where they currently stand with their IAAs, their funding and financing strategies and family engagement so that they can kind of understand where to go from here. You'll see these topics in the larger table in the draft TA plan. And this is sort of like the first initial meetings is where I'm focusing now. But as the states progress and as the year progresses, we want to move that forward and touch on additional topics like how to improve engagements with persons with lived experience, strategies to strengthen IAAs, state governance of this work, and policy opportunities that they could pursue around funding and financing as well. And then we want to make sure that there's peer-to-peer learning so that they can learn from one another, successes, challenges, means to overcome those challenges. And so the states are benefiting from the experiences of their peers rather than, going down the same path that they know won't work or pursuing something that might not be as successful as another state's approach. And then continuing along the year, topics will get even more in depth into funding and financing opportunities. It'll talk more about how to blend and braid funding. This might be where we really want some of these, payment experts on this group to weigh in and provide their expertise or some information from their work. And then also looking at how to develop and implement plans to make changes that would support that sustainability. So what are those policy levers that they can do to keep this work moving forward past that 12 months? So this is just, an overview. The TA plan was much longer than what I just said, and it had a lot of detail in it. But today we're really hoping for some feedback to that so we can keep refining it and improving it to make sure like will work for the states. We welcome, we want to hear sort of your feedback on the design, but also the topics, ensuring like, I guess, starting with, you know, if there's anything missing or stuff that should be further emphasized, points in the plan where you think you can offer resources or tools, or that you'd want to be, you know, a presenter at a full group meeting. We would love to know that. So today, I think I would really like to open it up to feedback. And so I can do that. I can stop talking and turn to you all if you have anything. But any sort of first reactions when reading it, or thoughts on the topics or structure, really, we can start anywhere.
I'm happy to start. Hi, everyone. It's Brina. I think this looks well designed. I think I'm always surprised when I join meetings and we're not acknowledging the elephant in the room, which I know is necessary in our world. But I think we're going to have, when we think about states' engagement in this space, I think we need some acknowledgement of the uncertain times. And it's so cool to have people on this call that actually can provide some of that steady at the helm feeling. So it's certainly not I, but there are people among us who could set the right tone at the beginning for, you know, the mission here. We're all in service of a better world for kids and families, and some of our what we're experiencing is at risk or something. You know, there has to be something, because otherwise we're going to feel like we're in a vacuum. And in that space, I would also acknowledge, and maybe this is not as true as it was when I first started as a Title V director, but there's a fair amount of level setting that has to go on. Like you say, I would really encourage some early talk on what on earth Medicaid is, you know, what it is and isn't. And as many of you know, that in Vermont, we had these innovative leaders in the 90s that completely transformed the way we use Medicaid administrative claiming. And so I can't really translate that to other states, because there were these policy decisions a long time ago about how Medicaid shows up in states with some specificity. So I wanted to get us started in that messy space of how one state's Medicaid experience is going to be different from another's right off the bat, which makes any kind of general TA a little hard when you're in your own state thinking, wait, we don't have that, or we do have this, and they're not talking about it. That kind of cross-talking.
Yes, thank you. Yes, thank you, Brina. I think that's a great point. And we are looking at, you know, what is that Medicaid 101 element that we can share across this. So Medicaid 101 around MCH and children with special healthcare needs. So I think that is a good point, and perhaps that should be some of the like didactic conversation early on, with the caveat of that, like, yes, this is obviously going to be unique to your own state, and being very open about the current uncertainties that we may have. But I think potentially that Medicaid 101 piece might be a good early topic to add. We're thinking about some resources, but maybe this should just weave into the plan. Jeff, I see you have your hand raised too.
Yes, and I think Christine in the chat just beat me
yes,
to it a little bit. Can you hear me?
we can hear you. Yes.
Yeah, there's a really good Medicaid 101 that the Catalyst Center at Boston University developed with the AAP, so I wouldn't reinvent that. I think that that's really good. I do have a couple of thoughts that I just wanted to share about this, because I think that, you know, how do I say this? I've suffered from doing this, so learn from our mistakes, maybe. You know, we have at the Children with Medical Complexity Center at Academy Health, we've done TA, and there's quite a variety of different needs for TA across Title V and Medicaid programs. And one of the things that may be worthwhile just going to suggest is to figure out what the priorities are for TA in different states and maybe try to cohort them, because some state may have a big priority for screening and early childhood visits and that sort of thing. Somebody else may have a big priority for children with special health care needs or behavioral health. And I think offering TA in sessions where there's a lot of different needs can sometimes be complicated. So I don't know if you want to do that, but that's a suggestion. The other thing I would just say is that I think it's really worthwhile to engage the providers in these states. We have Title V families and Medicaid on the list here, but a lot of times the providers are very dedicated and pretty crucial to that work. So thanks.
Yeah, that's great. I think grouping by priority is an interesting piece. The part of this is, we don't know what we don't know yet. When we send out the application, we want to learn about their priorities. So I think that can help to inform it. The design of the meetings and such is hopeful that we're hopeful that we can do some of the elements of the peer learning and then also have those unique priority monthly sessions that are, moving along a unique action plan. But perhaps those could be grouped together, or states with similar priorities could be connected into, smaller peer groups and or facilitated discussion across them too. So I think that's great. And then the engaging the providers is a wonderful point. I think that's something that we'll definitely want to work with states to do. And then the last thing I wanted to say, I know there's other questions and hand raised, but Christina, would you be willing to share those videos and webinars with us? I think those would be great to pull and see what what's already out there. We probably, someone else on the team probably has found it, but it'd be wonderful if we could share things like that.
Yeah, we're just finalizing them. So they will be available very soon, and I will definitely share. And I also I mentioned this in the chat too, but we'd also be happy to connect any Learning Collaborative participants with state AAP chapters if there is an interest. Just getting to what Jeff said about connecting with providers as well.
Great. I'm writing that down as a note.
Yeah, that's great, Christina. Really, really helpful and exactly the kind of thing that we're looking for from you all. If you know of things that are being developed that we could use, I think Jeff's point of not reinventing the wheel is absolutely where we want to be. So, and you all are doing great work, and Catalyst does great work. So, yeah, that's awesome. Deborah.
So I see, I wanted to, Beth, I want to just flag the question in the chat from Naomi really quickly, and then Deborah, I can turn it to you. The question was, will states have persons with lived experience representation in the participating state teams? As of now, Naomi, it's not a requirement that they have letters of commitment from individuals with lived experience when they apply, but that one of the first things we're going to be doing with them is that FESAT to assess their level of engagement of families and persons with lived experience, and working towards improving that and increasing the amount that they do hear from the community and from those that have been through this and can lend that lens. I think states have varying degrees of how much they have persons with lived experience on sort of boards, et cetera. But I think there's, the back requirements that have come out recently for Medicaid might be playing a role in changing this. And so it's on the, radar of states to increase, for Medicaid, for increased beneficiary inclusion and decision-making. And so I think this will be a great time to also get states thinking about persons with lived experience in the MCH space. So I think, Deborah, you want to go ahead and ask your question or any comment you had too?
Sure, thank you. And thank you for providing this overview of the TA plan. I think from my perspective, wearing my Title V hat, we know that the Title V programs right now are in the midst of completing their 5-year needs assessment. And many of them may be thinking of their work with Medicaid to include within this application. So as you develop this, it's kind of, you wish this project occurred a year earlier because it could have helped inform the Title V applications. On the other hand, it would be interesting to see what your chosen states would have put in their application and what they may, as you said, prioritized as their work with Medicaid. I see that, thank you to Christine for putting in the desire for us to help you find the AAP state chapters. In many states, there may not be a lot of pediatricians, and it may be our family medicine colleagues who are providing care, or our colleagues who are nurse practitioners or physician's assistants. So making sure that perhaps those groups, when you look at providers, are also included in some of the work that the states may be doing. So those are just some of the top of mind thoughts that I had to begin with.
Mm-hmm. Yeah, definitely lean on those colleagues too at AAP and others. I think Michelle even put in here the primary care associations, making sure that for all states, regardless of whether they're more pediatricians on those boards or not, that we're getting that lens and included somehow. Okay, and Michelle, what did you have a question to raise too?
Yeah, I do. Thanks. And I'm realizing my question might not be about what you're focused on right now, which is the actual setup of the TTA plan. But I'm curious, as you're developing the application, you're looking for 7 state cohorts, and that's 7 at a time, right? Is that every year? Is that 7? I can't remember yet.
Yes.
Yeah.
Okay. So then what would make a state eligible to participate, and what would make their application competitive so I have faith that you're going to get so many applications that you'll have a lot to choose from. I'm just curious how you make those decisions.
Mm-hmm. Right. We're working through that now. So we are working together with HRSA to finalize what that application would be, but it's aiming to understand what their priorities are, what their current work is, blanking on other sort of key details, but then understanding readiness.
Yeah.
Yes, thank you. The readiness and sort of their experience with some of the close, but like some of the sort of same mechanisms, but in different areas would be fine too. And then also trying to figure out that scoring rubric. How do we take, how do we figure out that selection and understand how to score or take subjective information to an objective decision of yes or no? We are really hopeful that we'll have a large amount of applications as well, but that's still in the decision points a little bit still in the works, and without having seen applications of this nature before, it's a little tough to guess. And so we might the first year or this first cohort, have a plan in place and be flexible to understand like who might be the lead agency that's responding and how that may be different across. And so do we need to be flexible in our scoring of applications based on which agency is applying? Oh, yes, sorry. So added into the chat that it would be like a competitive process.
Yes, and that if you do get a wide enough array of states, maybe you can see who's in the pipeline for next and what is it that they need to do for being readier next time.
Mm-hmm.
That's a good word, readier, right?
Yeah,
and in that, sorry, go ahead.
No, go ahead, Michelle. I
was going to say too, and just thinking through some of the learning collaboratives I helped run many years ago, one other thing that I'm going to suggest, but I'm of course assuming you've already talked about this, is thinking through what you need to see in an application on paper to guarantee their commitment to participate in the face of high rates of staff turnover and just other things that are happening and keeping state agencies so busy.
Yeah, that's a great point. And all of those things are, as Helen said, we're talking through like in this moment with HRSA and deciding that scoring rubric and deciding what that ideal application looks like is for scoring, and then how we would attach some objective criteria to the application to do that. So I think that's great. I think there's another potential area to identify states that would be good cohort states in terms of our customized TA that states can get right now without even being part of the cohort, is that they are able to go onto our website and fill out a request form. And as we start walking through that one-on-one customized TA with them, we may find that they're leaning in the direction of you'd be a good candidate for a cohort, for the following year. So
that's great.
And I just wanted to point out Jeff's and Heather's question in there, and not to be evasive, but we have some thoughts on this, but would love to hear what you think based on your experience of what would be a good level state official to make sure to agree to work on the coordination between Title V and Medicaid that would be good enough to ensure that we really move the needle in a state. So I'm turning it back on
this.
You, Jeff and Heather.
That's a great question for folks that have done the MCH, the Title V job, which you have several of us on. I think people have variable, commitment. I mean, we've done a bunch of these in Vermont with some sort of early childhood TA thing where we had to have our Agency of Human Service Secretary and the MCH director and the Medicaid. And it was a very prescriptive application where you had to have sign off that the person from Medicaid had to actually put their name on it, and the MCH director, and you could even have the AAP chapter commit. AAP has a lot of experience with this, right? With things like the teams work we do in school health. And so I said this in the first meeting, I feel like the roster of who would make this an effective experience matters. That you don't really want Title V director trying to do this and then have Medicaid folks intermittently show up or not be the transformative partner that's actually going to yield any product out of this. So that's a long way of saying I think it's probably okay to have it be at the MCH director level or the Title V level, not to make this like a commissioner level. That happens a lot when you're an MCH director. The commissioner comes down the hall and says, you need to do this thing. Like the National Governors Association said they're focused on pregnancy care this month. Fill out this form, so it's not a terrible pathway to use commissioners, or state health official leaders, but I prefer that we try to start with the passion point of Title V. But I really like rosters, and I do like scavenger hunts. I like it being, you will be a successful application if you have these 4 people. And I should have said at the beginning, what VCHIP, where I work now, the Vermont Child Health Improvement Program, is this innovative partnership that's been going on for 28 years that other states have tried to replicate, which is Medicaid, AAP chapter, the public health system, and the academic medical center. It's a pretty cool thing that we do. It's called an improvement partnership. And I was just on the national call yesterday. States have variable engagement with Medicaid that have tried that. We've been up as high as 30 states that have had an improvement partnership, and we're back down to like 10 because it's a tough time. But I don't know how to leverage that. I just wanted you all to know that. I've talked with AAP leaders, MCHB for years. We have a lot of people that know about what we do and think it's cool, but we're having, obviously, we just happen to know that's our success, is that the table. It's a set table with those partners already at it, which I would love for folks that come into this TA to feel that they had a committed table.
Mm-hmm. Kimberly, did you have thank you, Brina. I think that's actually an interesting point, and potentially at the application we could think about, guidance of, a competitive application demonstrates like commitment from the staff and other ways of looking at this too. Kimberly, did you have a question too?
Just my personal experience as a Title V director and again, cut me some slack because it is my first meeting. So I was just going to say our experience in a really small rural state has been that Title V can try to move things along as much as we can. And we really do have a good working relationship with our Medicaid office. However, we haven't really been able to make a lot of traction unless we have at least the Medicaid director, if not the Medicaid director, the deputy director. Anything lower than that just kind of seems like it gets lost and it really needs to go through this different level of approval. So as we're looking at having success with some of these different initiatives, I would recommend at least having the Medicaid director, maybe the deputy director, but I wouldn't go down as far as having like a designee.
Okay. Thank you. I think from my experience with, not in this specifically, but in working with Medicaid, really do agree with you there, Kimberly, about the decision makers, the drivers are that director and that deputy director level. So I definitely would echo that. Jamie, did you have a comment?
Yeah, just to kind of tag on to that, I too would advocate for at least a deputy director, but then paired with an MCH director. And I know we had a conversation at our last meeting that not every state has an MCH director specifically, but the person within the agency that really specializes in that area, just from a substantive standpoint, to have that expertise at the table along with the decision maker, I think would be in a perfect world how you'd want to structure it.
Okay, great. So looking at our time today, I am going to go ahead and, oh, Naomi, do you want to get one last thing in before I move us along?
I do,
Yeah.
and not to belabor the point, but I just want to, and I know that there will be representation and support from Family Voices and TA with the cohorts, but part of my push is trying to say and to encourage that the teams that apply, for them to be thinking about having someone from that level. So just as we're talking about having the Medicaid director, deputy director, having the Title V director there, having family representation there to be a part of the conversation and the co-design as well, as opposed to waiting until later. So I understand that there will be support. So even if it's not a person with lived experience, at least having a community-based organization that deals with maternal child health, there has to be some sort of family representation, in my opinion, for it to help to be effective.
Yeah, no, I completely agree with that. And potentially that's that same point of, applications would be more competitive if you demonstrate this person with lived experience engagement. Because we do want to make sure we are emphasizing that as well. There are a couple other questions in the chat I'm seeing. Well, just to one, Kevin, we're finalizing the timeline right now. The current state we're in, we want to be cognizant of how states are dealing with some of this uncertainty. So we are closely sort of figuring out what might be best and when it might be best to launch, but hoping for not too soon from now. And then Michelle, that's actually, you kind of took the next agenda item right off of my plate. So Laura, if we can go ahead to the next slide, I want to dive into some of those other pieces. So Beth did mention the customized TA. This is active. The TA plan alluded to this and sort of the other elements of the TA that we'll be providing, but what it includes is this customized one-on-one TA and the universal TA resources that will be on the website and available to everyone. Right now, we're finalizing sort of the exact scope and guardrails of this customized TA, but it's already begun. It's already started. There is a form on the website where states can go and request unique TA. So we will likely soon start wanting to promote that more so that states know that it's an option and we can continue working with them. Our CMMP TA team has already started working with Maryland, actually, if I can, let that, we've had a meeting, we're gathering some information and having a follow-up meeting with them to talk about a couple things that they were interested in specifically. But we want to, this slide here just kind of shows a snapshot of how these happen. request submitted, we triage it, figure out based on their request who might be the best avenue for helping the state, and then they can respond and take action and do sort of follow up as needed, more like an informal TA plan with just that one state. And it's a shorter window, but sort of resolving what they're really looking for. And if they need more, encouraging them to continue to like submit these requests. There's no limit to what they can request. If there are specific things that you would like to be notified about when states ask for support, please do let us know. And that way we can ensure you're informed. But in general, we can continue to provide updates on these calls quarterly so that you all know sort of the general flavor of the requests that are coming in and the work we're doing with states. But this is definitely something we're going to want to continue to promote. We're attending the AMCHIP conference that's in DC in what is it now, Mallory? Not 9 days, I think. So we'll be attending there as CMMP, and we'll want to make sure people know that this is an option too. So that is ongoing. If we go on to the next slide, I do want to touch today on the resource repository. These are going to be, this will be a place on the website, and we can go one more slide, Laura, for a library of resources. These will be from external sources, so we would love to be able to share those materials that you mentioned before, Christina, when they're ready and out there. We'd love to promote them on the website. But we also want to develop some of our own universal TA resources that will be informed by the work of the cohort and our TA and just sort of some of the general experts. So we are building a plan to create some of those. But right now, we are sort of still compiling, still making sure that what we put out there is appropriate and aligned with current requirements, and making sure that we're that it's topic specific. You know, it's relevant enough to CMMP to fit. So we're in the process there, but on the next slide, I just want to sort of kind of a call to you all as we're working with our team to sort of identify potential resources that we could share, and developing new resources that could be housed in this site that pertain to the specific topic areas. We would welcome anything that you all have created recently, have promoted recently, would like to cross promote with this site and yours. Please consider if you've got some ideas and share that with us so we can get them on the website. We want to make sure this library is useful to people that visit, and, you know, get some materials out there that can be good. So I'll leave you with this, a couple quote unquote asks. One is, you all have the TA plan and draft. If you have additional thoughts or want to share more formal thoughts than said on today's call, please do email us. We would welcome any feedback, small, large, anything you're thinking, we would welcome that. We also would welcome any sort of connections to, resources or TA centers that are ongoing. I know we've, aware of some others that we want to make sure that we stay aligned to, but we welcome that. And then lastly, we may be reaching out soon with a request to kind of, share with your audiences that there's customized one-on-one TA available through the CMMP. So we might come with an ask, and in the hopefully near future, ask to promote the application once that's moved forward. But we'll have more information on that as it comes. I think for now, that's mostly what I wanted to share today. And in the interest of time, I will turn it back to Beth so we can wrap up with a few questions and final pieces.
Awesome. Thanks, Helen. I know that kind of went quick there, the last couple of slides on, especially on the customized one-on-one TA. I just kind of wanted to take a quick second and see if anyone has any questions about the role of the TEP and, what we may or may not ask you to do. I think that the customized TA is a really good example of where we may ask individuals on the TEP for some help every once in a while as requests come in. But that overall, we won't overly burden you with a lot of requests and things like that. any questions about the role that you all have on the TEP and where we're going with that. And it's fine to email us as well when you provide input on the TA plan, you know, as Helen has said, or if you have resources that you want to give us, to be able to say, you know, hey, this is where I think you may be missing expertise on the TEP or a role on the TEP too. But did want to give folks a chance to raise any questions that they might have about roles before we moved on.